Hello and welcome to our podcast on how to enhance your asthma knowledge. I'm Sara Hope, Senior Communications Manager at Education for Health, and today I'm talking to our Assistant Director in Clinical Learning, Preeti Minhas. At Education for Health, we aim to improve the lives of people with long-term conditions by supporting the development of healthcare professionals through training and education. As part of World Asthma Day this year, we're delighted to support the campaign by hosting a series of free webinars and podcasts. Today we'll be discussing how CPD plays a key role in asthma care. Preeti, welcome. Thank you for joining me.
Thank you so much, Sarah. I'm delighted to be here today to speak around how education and training is important in closing the gap in asthma.
Brilliant. Thank you. I'm so glad that you can be here. So first things first, why is CPD so important today?
Yeah, so I think, we've seen that there's so many advancements in health technology and medicine, and ultimately there are a number of changes in national and international guidelines. And therefore, as healthcare professionals, we absolutely need to keep our knowledge and skills up to date with these changes in relation to the area of practice that we operate in. CPD is there fundamentally to make sure that we are able to practice safely and effectively, which helps us to meet the needs of an ever-evolving healthcare landscape. But most importantly, it also enables us to meet the needs of our patients at a time when, patient expectations have changed. Information to our patients is readily accessible. Compared to potentially several years ago, people can Google their condition within 2 minutes and get an answer. So for us, it's really helping us to keep up to date with ourselves. So, from an individual perspective, I think that's why CPD is important. But I think also from an organisation perspective, the pandemic has really established the need for us to create a flexible workforce. And, we can only create a flexible workforce, so use our workforce innovatively at a time when, sometimes it is limited. And so creating that flexible workforce can only happen if our people have the right levels of skills and knowledge within a particular area. And so rather than, we often see, CPD being used on an ad hoc basis, I think if we need to move to this approach of having a flexible workforce, then we ultimately need to embed CPD as part of our culture, and that will enable us to meet the needs of our patients, but equally enable us to focus on service improvement.
Absolutely agree. I think we've definitely seen a massively changing landscape within healthcare in the last few years, haven't we? And I imagine with healthcare professionals being so busy in practice and within secondary care as well, that staying up to date can actually be a real challenge. So having that space to actually, really focus on kind of the new guidelines and make sure that they're all up to date with everything is really crucial.
Yeah.
So looking at kind of, specifically looking at asthma, how does this all tie in?
So I think I think if we look at the statistics of asthma, we saw the World Health Organization estimated that, more than 339 million people had asthma globally. There were over 400,000 deaths due to asthma at a global level in 2016. Again, if we break that down to a UK element, over 8 million people, or approximately, if you want to call it 12% of the population, have been diagnosed with asthma. And asthma accounts for 2 to 3% of primary care consultations, 60,000 hospital admissions, and 200,000 bed days in the UK. And, in 2021, GINA reported that over 50% of adults and children on long-term therapy for asthma failed to take their medication as directed at least part of the time. So I think if you look at those statistics in itself, it really shows that, we play a crucial role in developing the knowledge and skills healthcare professionals. And if we are to close this gap in asthma and see a positive shift in those statistics, then we have to really embrace CPD in asthma care.
Yeah, absolutely. I mean, those are some kind of quite daunting figures almost, 50%, kind of readherence to asthma medication feels quite high. So absolutely anything that we can do to support healthcare professionals in impacting those health outcomes feels really important. So in terms of if you're a healthcare professional, say, how would you decide what course was right for you?
Yeah, so I think, I get asked this question quite a lot. And I think the first thing is, we need to take a stop and we need to reflect on reflect on ourselves. So again, what is the knowledge and skills gap that we're trying to address? What is it where we feel our knowledge isn't at the very best, or we need a refresher on our, let's say, asthma knowledge? And what do we want to learn as a result of the course that we're going to undertake? So what do you want to do differently as a result of this course? Again, in order to reflect, we have a number of revalidation approaches across our healthcare professionals. And again, it's embedding that across healthcare and using that. So again, you may want to think about seeking feedback from your colleagues. What do they see that you need to improve on? Where do they see your knowledge or the skill gap may be? Again, start to use some of the patient feedback that you get. What do they want to see a change in you, in your practice? And using all of that feedback, it then enables you to get together and think, right, when I do this course, I want to be able to learn X, and I want to be able to change my practice as a result of this learning. So that reflection, I think, first and foremost, is really important. I think once you've got that reflection, then you need to start to think about, right, what type of course is suitable? Do I want to do a short, sharp piece of learning? Or do I want to do an academically accredited course where I get, like I said, official credits? And with that, that's based upon, you need to look at your personal commitments, you need to look at your professional commitments, because an academic course may be over a period of time, such as 6 months, like our level 5 and level 6 asthma courses, which are accredited by the University of Hertfordshire. So again, think about your time commitments, be realistic. If you do an academically accredited qualification, you're going to have to submit courseworks and assignments. And therefore, again, you need to take that into account when you are thinking about which course is the most suitable course. Again, think about, your employer as well. Have a conversation with them as well. I think, if we look at some of our level 5 and level 6 asthma courses, the one thing I always hear from our learners is, my employer won't let me see asthma patients until I've successfully completed this course. So again, get their feedback. What do they want to see from you? What are their requirements? And I think, moving on from that is also look at your career as well. Now, often we think of our career as a really linear progression. So, some of us have done our GCSEs, we've then done our A-levels, we've then got to get to uni, we then do the next course and think, right, if we do this next course, we get the next job. And sometimes it doesn't work like that. It's about building and establishing those portfolio careers. So, a course that you might do today may not necessarily move you up in that career ladder, but what they may do is to build that toolkit that you've got, I call it a career toolkit. So again, as you move on to different roles, you can pick, if you've done a course in the past, you may be able to pick the knowledge and skills that you did from that course. And if I look at my own career, I've certainly done that. There's courses that I've undertaken that didn't help me in that moment, but in my future career, they've helped me. So I've been able to go back to my toolkit and pick up those skills and knowledge that I acquired. So, building portfolio careers is really evident, and, take those opportunities and really grab them when there's that opportunity to be able to learn. And one of the things is look at the way you learn as well. I think if we look at it pre-pandemic, then we probably saw, you know, how many of us could say that we learn virtually? But I think the pandemic has really forced us to learn in a very different way. So, I often talk about the 70-20-10 model, which is an established learning and development model that we used, where we say 70% of our learning comes from on the job, 20% we learn through others, and 10% is in a classroom setting. So, when we went through that phase of changing our courses to that virtual interactive online learning, what I did see is that 20% where we learned through others was really enhanced. And that's reflected in a lot of research today. Um, you know, um, for instance, by Donald Taylor, who, talks about because of the likes of social media interactions, because we're constantly on the laptops and the computers, the way we learn from each other, that 20% is enhanced than what it's been before. So if I look at our courses, for instance, our workshops, our academically accredited courses, we've built that into our learning. So again, when you see if I take our courses as an example, you're not learning virtually, you're not on your own. There is somebody there to support that learning. So again, it's finding a course that caters for all of your learning needs.
And I think that's something that we always, hear back from our learners as well at the moment, people on, our courses currently. It is that positive feedback around the interactivity, being able to not just have the support of one of the module tutors on the course, but also actually that interactivity and that kind of online platform to share knowledge with their peers as well. Kind of always seems to enhance everyone's learning, which is really wonderful to hear.
And I
So
think I think it goes back to, sometimes it's not just what you're learning on a course, it's sharing experience. So it's about sharing, when things haven't gone so well as equally of when they have gone well, or,
yeah,
seeking a feedback. There's a lot of regional variability in health right now. So, where you have that platform to be able to share, I often see that somebody down in London might be doing something differently in terms of the asthma clinics that they're running compared to somebody, up north or vice versa. So I think it also provides you an opportunity to, like I said, is learn from what's gone well, but not gone so well as well. And having some peers there to be able to share that, I think is really important when we're really trying to close the gap in asthma.
absolutely. So in terms of, kind of what changes in practice might people expect to see as a result of enhancing their asthma knowledge?
Yeah, so I think, if I look at our courses across the board, so we run obviously our CPD accredited courses, which are things like our essentials and our refresher courses around asthma. And if I then look at our level 5 and level 6, asthma courses, we've seen, it's great to see when people have changed their practice as a result of their learning. So some of the things that, we've seen is, healthcare professionals saying, I have the knowledge around stepping up and stepping down asthma treatment, but not only do I have the knowledge, I'm able to apply it in a consultation. And I think, they've been able to change the way that they engage with the patient. They're able to use a person-centered approach. I've seen things when I've looked at, the evaluation that we get from our learners. I've, seen our learners saying that they engage people, in on the importance of a personalised asthma action plan differently to what they used to be able to do. And again, getting that knowledge around why the, PAP is important is one of our key findings. Again, it's about engaging patients on aspects such as inhaler techniques. So again, if you saw one of those statistics I mentioned earlier that Gina found in 2021, again, it's great to see that, following completion of our courses, people are able to, like I said, engage with their patients differently on aspects such as inhaler technique, which we all know is imperative in asthma care. And again, I mentioned this previously, but again, it's around looking at that person as a person, rather than addressing our consultations as an almost checklist, which ultimately, if we start to tailor our advice when we are engaging with a patient, rather than using it as a checklist and saying, right, I've done this, I've done this, I've done this, it changes those outcomes and it delivers a more positive outcome in asthma care. So I think they're probably the real highlights that we've seen as a result of, for instance, people completing our courses and enhancing their asthma knowledge.
Brilliant. Thank you, Preeti. I think it's always coming back down to that kind of that patient care and improving that health outcome, isn't it? It's a really important thing to be a part of.
Yeah, definitely. And I think it's like I said, some learning, will be short and sharp. Some of it will be more, it'll be more concentrated. But it's about, using every piece of learning to be able to change your practice and say, right, what could I do as a result of this learning? What can I do differently? Because we all can do things differently. Some of our approaches may not work for some patients, whereas they may work for others. So you can never ever have a static approach. You need to be dynamic and be able to change that, and that comes through learning. And that's why education and training is just so important.
Absolutely. Well, I think we've covered a huge amount already today. So I think that brings us to the end of our podcast. For anyone listening, you can find more details about our courses, our training, our free resources via our website, www.educationforhealth.org. You can also follow us on Facebook, Twitter and LinkedIn. And again, all of those are linked to from our website. We hope that you enjoyed today's podcast and thank you very much for listening.